if you have a hormone deficiency, which often happens during those years, treat the hormone deficiency, and then you don't have those symptoms. And actually, there's a lot of protective benefits. Women who have a healthy level of estrogen are less likely to have heart disease, cardiovascular disease, less likely to have Alzheimer's disease, less likely to gain weight, have more energy, don't have a decline in sex drive, which women experience in that time frame.
What if there are things we never had the opportunity to learn? We've all been to school or training, but there are things they never taught us that actually make a powerful difference in life. I'm here to share with you all the pieces you've been missing: mindset, health, success, and more. And we'll all learn together from guests along the way. We may not have learned it the traditional way, but oh my goodness, let's keep learning how to do things differently. OMG, hello, my friends. I am happy to be back with you today. And maybe you caught a couple of months ago the episode that I did with Allison Blad on weight gain in menopause. Or maybe you are investigating midlife topics in general right now. And unless you're living under a rock, you have probably heard at least a little bit about HRT, hormone replacement therapy. And maybe you have heard opinions as to whether it's safe, whether it's a good idea, whether it's a bad idea. That's what we're going to talk about today. And so I have an expert with me, and she is Dr. Gina Nick. She is a world-renowned naturopathic physician, researcher, and formulator based in California. She has a dedication to holistic wellness. So, of course, this is someone we want to talk to here. She is known for her expertise in treating a wide range of health concerns, from autoimmune diseases to addiction recovery, anxiety, and more. So, Dr. Gina, welcome.
Thank you, Cheryl. It's a pleasure to be here.
I'm excited to talk to you about this because I know you're going to give us a lot of insight. So, my listeners know, I always like to start with our stories because I find that particularly people who work in healthcare or mental health or mindset or coaching, we got there because of our own lives, typically. So tell us how you ended up working with women's health and in naturopathic medicine.
Well, I always wanted to be a doctor. From when I was in elementary school, I was like, I am going to be a doctor. So I think I was, probably brought into this world with the plan to become a doctor of some sort. And so I went the traditional route, doing pre-med, and I was a nurse assistant in high school and kind of got into medicine that way. And I had a lot of wonderful mentors along the way. But when it came to deciding on a medical school, my honors academic counselor at UCLA said, he handed me a brochure for naturopathic medicine and a naturopathic medical school. What is this? And mind you, this is decades ago, before anybody knew what a naturopathic doctor was.
Right.
And I'm like, oh my gosh, this is perfect, because I was always off researching nutrition. And, even though I was studying the sciences and I was very interested in social psychology and psychology and all of those things, I was really interested in nutrition. And so I just had this natural inclination to want to learn more. And when I learned that there was this type of medical school that existed where I could learn all of the allopathic medical sciences and study the human body in depth, et cetera, and also learn about a more holistic approach, where you see the head is connected to the rest of the body and really looking at mind, body, spirit, soul, all of it interconnected. And so that kind of started my journey. I went and met with the president of an accredited naturopathic medical school in Arizona, had just begun. And that was it. I flew out there. I met him. I said, this is what I'm doing. My family was like, what? You're graduating with honors and Latin honors, and what are you doing? And I had a relative who was like, at the head of the UCLA Medical School, division and all that. And they're like, "Are you sure?" Yes, I was very sure. And I never looked back, and it's been a wonderful experience ever since. And then when I was in naturopathic school, about 3 years in, I started to have weird symptoms. Like I would all of a sudden pass out for no reason. I had all of these doctors around me. I had lab work done. I was young. There was no reason for me to feel the way I was feeling. And that kind of led me on a path of learning about detoxification and hormone balance. And that was it for me. I'm like, what? There's this human detoxification system. And by changing your diet and by doing some of these lifestyle things, you can heal yourself. And even though I was in naturopathic medical school, that was like an aha moment. So I kind of did my own research and study while I was in school. And so, I feel like I was divinely guided all the way through. And then fast forward, I graduated, started my medical practice, and I just kind of started treating a lot of women, and in that perimenopausal and menopausal phase, which perimenopause can last 10 years. Perimenopause just means before menopause.
Yeah.
And I can kind of go into all the more detail there. But anyway, I had learned about bioidentical hormone replacement therapy, and I had taken a bunch of continuing medical education courses, and I was amazed by how impactful hormones are to how you think, your moods, your immune function, how you look, the whole bit, how driven you are. I mean, it was amazing to me. And so I've done just a deep dive into how to use hormones in a healthy way to support women's health. And then, I became a mom at kind of a later age. And so I went through that whole pathway of, having miscarriages and then working with hormones and detoxification to help me to have a very healthy pregnancy at a time when I shouldn't have necessarily had a healthy pregnancy. And so that's really, and then after having my daughter, she's going to be 12. My God, my focus really became on supporting women,
Yes.
supporting mothers and everything in between. And so that's really the high level story of how I got to where I am now. I'm very committed to helping women. And now me being, at my age and going through all this with the women in my practice, it's just an area I feel like women are amazing and have so much to offer. And because I brought up detoxification because we're exposed to so many more toxins in our environment these days, and it is impacting women a lot because some of those toxins mimic hormones like estrogens, and it particularly affects women because as we're going through that perimenopausal phase, your estrogen levels go up, they go down, they go up, they go down, kind of go all over the place. And if our bodies aren't properly clearing those hormones out of our system, and then we're exposed to these toxic chemicals that mimic hormones in our body, well, then you're going to have a lot of symptoms, and it's not necessary.
And you know what? That's the thing that gets me is that I think we've kind of started feeling like these things are just how it is. We're going to be sluggish. We're going to be gaining weight. We're going to be all the things. And that's how it is.
Right.
Yeah.
No, and then that's what our mothers and our grandmothers, that's what they knew, and no, it's not the case at all. There's so much that can be done to support women and even hormone related disorders that women face, whether it's endometriosis or PCO, polycystic ovarian syndrome, and all the way down the line. And supporting detoxification and making sure your hormones are balanced address all of those conditions.
So let's dive into those two things then. Hormone replacement therapy and hormone balance I feel like there are these terms that, we all think we know what it is, but maybe we don't really know what it is. So I want you to kind of give us an explanation of that. And then we'll come back to detox as well, because that's important.
It's really important. They're so interconnected. A lot of people don't talk about that. So hormones. Your body makes hormones naturally. In women and men make estrogen, progesterone, testosterone, DHEA, cortisol, pregnenolone. Those are some of the main hormones. The biggest ones for women seem to be progesterone, estrogen, testosterone, and cortisol. And as we grow up, I like using the term grow up. I have a patient who's in her late 80s, just published her third book, vital, beautiful, runs every day, amazing. And she always says, Dr. Gina, don't tell me about aging. I'm just growing up.
I
So,
love that. I'm going to have to use it. Sometimes I say we're getting seasoned. I'm more seasoned.
yeah. And so as we're growing up, naturally our hormones start to decline. And the first hormone to decline is progesterone. And progesterone is a very calming hormone. So it helps with anxiety. It causes what's called vasodilation. It helps with sleep. And so that's the first hormone to start to go down. And then after that, estrogen starts to go down. And estrogen is the hydration hormone. So you think hydration of the skin. So we start to get dry skin, dry eyes, but even hydration in the brain. So we start to get foggy thinking, compromised memory. Estrogen impacts vaginal lubrication. So you just think everything having to do with hydration starts to decline, right? And then we start to experience weight gain, particularly in the midsection.
Yes.
That's supposed to be natural. It's not natural. You don't have to gain those 10 pounds. You don't have to have a belly. You don't. Just because you are growing up. It just has to do with hormones, and balancing your hormones out in a healthy way.
Right.
And when I started to study hormones, what I found fascinating was there's no documented benefit to a decline in hormones, right? So you would think evolution wise, okay, so why do our hormones decline? Is there a protective mechanism there? But no, hormone deficiency is associated with all of the diseases related to aging.
Okay.
So age-related diseases are tied to hormone deficiencies, but there's no benefit.
Isn't that interesting?
Yes. Yeah. But there's a lot of benefit to treating those. So I look at it as deficiencies. Just like if you have a vitamin C deficiency, take vitamin C and it helps to balance out your immune system, gives you healthier skin, etc. Hormones, if you have a hormone deficiency, which often happens during those years, treat the hormone deficiency and then you don't have those symptoms. And actually, there's a lot of protective benefits. Women who have a healthy level of estrogen are less likely to have heart disease, cardiovascular disease, less likely to have Alzheimer's disease, less likely to gain weight, have more energy, don't have a decline in sex drive, which women experience in that time frame. And so, anyway, that's kind of the big picture look at hormones in women.
So I'm going to ask a quick question that I am always trying to think what would be going through people's minds. So if we get really good at replacing these hormones, does that mean we even delay menopause? Does it change how women go through that?
So every woman has a different experience with how they go through menopause. For some women, so menopause, the definition, technically, it's you haven't had a period for a year.
Right.
And your hormone levels go down. So your estrogen level is low, your progesterone level is low. And then your brain also secretes hormones telling your body to make more estrogen, progesterone. It's called FSH and LH. So all those numbers go up and then estrogen, progesterone go down, and so that's kind of like the process, what happens, and when that happens, you start to have symptoms of, estrogen deficiency, progesterone deficiency, and so forth.
Okay.
So, yeah.
So what is it about hormone replacement that causes us to feel like it can be risky or dangerous? I feel like we hear about risks, maybe not so much as in the past. So maybe it's changed now how we do it, but I know that that's a thing.
Yes. So there is a huge difference between synthetic hormones and bioidentical hormones or hormone chemicals in plants that mimic hormones in the body that look similar to hormones. And so huge difference. So synthetic hormones are things like progestin. So when I say progesterone and the healing benefits of progesterone, that's what your body actually makes.
Right.
Progestin is a synthetic form. So like what's in Prempro, for example, and progestin can have toxic effects on the body. Okay. And so there was a study called the Women's Health Initiative that came out years ago, and it was talking about all of the dangers of hormone replacement therapy, increasing the risk for breast cancer, ovarian cancer significantly. And so doctors started to say, okay, no hormones. Don't give women any hormones, which was so sad, It's like all of
Yeah.
a sudden we were like, whoa. And what the research showed was most of the risk was associated with unopposed estrogen and using synthetic progestin. So what does
Right.
that mean? So women who are taking just estrogen, there's a term for estradiol,
Mm-hmm.
okay, or Premarin, which is actually estrogen derived from horse urine, Premarin.
Yum.
That you kind of want to stay away from, especially because you have access to bioidentical estradiol. So women who just take estrogen, that doesn't work either. That can increase risk for breast cancer. And the reason is because it's what's called unopposed. So like everything in life and like everything in the body, it's about balance. Right.
Mm-hmm.
So estrogen and progesterone kind of work together. And progesterone has to be there too. So you can't just have all of a sudden a bunch of estrogen in your body and no progesterone. You have to balance them out. So unopposed estrogen can increase risk for breast cancer. However, if you take bioidentical estrogen and you introduce bioidentical progesterone too, now that's a healthy balance. And you have to work with a doctor who knows what they're doing when it comes to hormones. You really do. A seasoned doctor who knows what they're doing, knows how to test for these hormones, knows how to really learn about your body and what is going to be best for your body.
Mm-hmm.
But yeah, when you take the bioidentical hormones, it has a different effect than those synthetic hormones. I always advise women against taking progestin in particular. If I had to pick one of the hormones to stay away from, I don't see the value at all of progestin, and I see that it increases risk for cancer.
Okay.
So, and that's a lot of women. You hear hormones and you think, oh my gosh, But again, the bioidentical hormones and the research, it just keeps coming out on the protective effects,
Mm-hmm.
especially of estrogen. It's very protective to a woman's body,
Right.
And you don't have to take it in a drug form. There's natural over-the-counter things you can take also.
And okay, that's actually not what I was going to ask next, but let's follow that little, let's pull that thread.
Yeah.
The self-image we have in our minds, the way we think of ourselves, is such a powerful thing and really directs everything that we do. And one piece of that is feeling good about how we look. So if you want to feel good in your skin, wash your face every night, make sure to moisturize, and check out my favorite skincare, which is Derm Results Advanced. You can find it at omgteachme.com/recommendations. There are a lot of over-the-counter plant-based estrogen mimicking type things that I see. So how do we know, are they a good idea? Are some not? Is there a way we can know that?
After doing this for 20 plus years, every woman is different. Every body responds differently. Some women, it's like, for sure, bioidentical hormones are the way to go. Like it just, and sometimes women come in and they don't want to go that route. And so we start without them, and then slowly over time, I'll have women try them and see how they do and then take it from there. It really, so, the over-the-counter, like herbal medicines, black cohosh and red clover, there's some I think they're wonderful. And if you're able to, your body resonates with that and you're able to balance things out with those, use that. Stay away from the prescriptions. You don't have to deal with, going to the doctor and getting the prescriptions and deal all of that, but that's not always enough. There are some topical creams, progesterone and estrogen creams that you can get at the health food store. You can always start with those and see if those resolve your symptoms,
Okay.
because every person has a different number of hormone receptors in their body. Okay. And so depending on how many receptors you have, it makes a difference on how responsive you'll be to an herbal formula versus taking bioidentical hormones.
Ah, I see. Some people are absorbing it better because they have more receptors, basically.
Yeah, they respond better. But then also by taking bioidentical hormones, you can actually activate receptors that have gone dormant. Yeah. which that's another interest. That's a whole other area, but that's also can be part of the process of balancing a woman's hormones out, is going through a protocol to help reactivate receptors that have gone dormant. And that can take time.
Mm-hmm.
So I always tell women, if you do go on bioidentical hormones, the first month you'll notice some benefits. Stick with it. The second month, you'll notice more. The third month, you'll notice more. And it's cumulative up to about the 6-month mark. And that's kind of when you really know what bioidentical hormones are going to do for you. It can take that amount of time, but you should be noticing increasing benefit, over that period of time. So it's taking it for a month and saying, look, I took it, I felt horrible, it didn't do anything for me, I'm done. Maybe not the best mindset to have if you do choose to kind of explore that world of hormone balance therapy.
Okay. That's really helpful because I can see someone getting frustrated, and I can also see someone going to 6 months and thinking, well, is this enough time? So that's good to have a window.
Yeah. And then also making sure you're testing. I'm a big advocate for find out what your hormones are doing. Find out if your symptoms are really tied to a hormone deficiency or progesterone deficiency, or if it's something else.
Right.
Right. I'm a big fan of glutathione. I'm very passionate about this master antioxidant. Some women just take glutathione and they feel better, and it helps to balance their hormones because it's supporting detoxification. It's supporting the body's natural ability to rebalance itself, and then women aren't feeling like the toxic effects of synthetic estrogens.
Mm-hmm, mm-hmm.
Because so as your body makes less estrogen, right? You have these receptors. So it's like a lock and key. You have estrogen receptors. You need to have the estrogen to bind to the receptor. And then you have the action of increased lubrication, reduction in memory loss, etc. Healthier skin. And so, you have to, if you're not taking in estrogen, you've got these receptors. And then we have these xenoestrogens, which is basically toxic chemicals in the environment that mimic estrogen. Guess what? They will bind to those receptors. And that can trigger things like cancer, inflammation, all the stuff you want to, avoid and stay away from. So you want to make sure that you're doing something, that to not leave those receptors open to toxins. So one thing to do is to take something to remove those toxins on a day-to-day basis.
Yes.
Right? So you're not experiencing those effects.
So you explained that really well. And actually, I don't think I'd ever heard it said quite that way. And I think that's going to be helpful for everyone because I know about xenoestrogens. And I think people probably listening have heard, would phthalates be one of these? I know there's just lots of things in things we're slathering on ourselves all the time, right?
Oh, yes. Your skin absorbs everything. We're putting all sorts of stuff on our skin. I mean, that's a whole, go to the environmental working group. I always advise people to look up that organization, and they always have, good up-to-date information on where the highest exposure is to some of these xenoestrogens through skincare, makeup, cleaning supplies have xenoestrogens in them, all the way through to just breathing.
Yeah. Unfortunately true. Yeah.
Sorry, do something every day to be supporting your detoxification mechanisms, and that will help with hormone balance. Absolutely will help, and will help protect your body from the harm of hormone imbalance.
So glutathione is one of those things. And what are there any other kind of simple detox things that people can take away to start doing?
Yeah. So I am very passionate about glutathione. It's like it is because there's over 100,000 clinical research studies using glutathione. Easy to take, and you can take it daily. Any of your dark green pigmented vegetables. So that dark green pigment is chlorophyll. Chlorophyll binds to toxin and pulls them out of your body. So, the dark leafy greens. These days we have access to so many different options there. Vacuum dried, organic greens. Highly recommend doing some form of greens in your diet every day. Sauna therapy is a wonderful way to support detoxification. daily. So that's not something you're eating, but your skin is your largest detox organ.
Yes.
So if you're, doing a sauna daily and get sweating out some of this stuff, there's so much research on it. It's so helpful for women. So helpful, especially if you do it like before bed, if you have trouble sleeping. Sauna therapy can be amazing for that. Exercise is a great way to support detoxification. All of your brassica family of vegetables, so that's things like broccoli, radishes, kale, if you don't have a thyroid issue. So some of those vegetables have chemicals in them that support what's called phase 1 and phase 2 detoxification in your cells. Wow. And mind you, your cells are detoxing 24/7. All of your trillions of cells have innate mechanisms that are constantly detoxing all the time, which is amazing that the body's designed that way. It tells us there's something to this detoxification thing. It is super important to your health and well-being. And we are being bombarded with more and more toxins in our environment, and we can do something about it. We can be self-reliant and just take those, be conscious about it. And as women, I think most of your audience is women, I assume. Yes. Okay, we're all so busy and we're all multitaskers and we're moms and entrepreneurs and stay-at-home moms and non-moms, and but women in general are always doing a lot. And yes, so
we are. It's true.
As a woman to a woman, I'm saying it is worth it to decide on something that you're going to do every day that supports your body's innate detoxification mechanisms. Smart. If it's green juice or, eating your broccoli or broccoli sprouts, radishes, to just, again, from a mindset perspective, decide that you're going to take action every day to support your body that's working for you 24/7 to detox. And just that, without taking any hormones, it's going to help you through that whole time,
It's really fascinating because we have talked before this conversation, and that was the first time that I had really put together this idea of hormones along with detoxing. And I find it odd. Why had I not heard about the fact that that's so interrelated before? So I'm glad we're talking about it. Now, I want to ask about how people can find a doctor and everything, but let me just review for a second. So when you say bioidentical hormones, that's what you were calling estradiol, progesterone. I just want to throw those words out there again so people...
Yes. Yeah. You can even get bioidentical cortisol, right, which is different than prednisone. DHEA is a bioidentical hormone. Pregnenolone is a bioidentical hormone.
Okay.
Vitamin D3 is a steroid hormone. But yeah, it's in terms of estrogen and progesterone, you just always want to make sure you're asking for progesterone, right, and then estradiol.
Right. Very good.
Or Biest, sometimes called Biest, which is a combination of estradiol and estriol.
Okay.
So there's in the body, there's three main forms of estrogen that are produced. Estradiol is the strongest. Estriol is the weakest, but more protective against things like breast cancer. And so sometimes a compounding pharmacy, a doctor will prescribe Biest, which is a combination of the two.
Perfect.
If you do take estradiol, I always recommend the safest way to take it is actually vaginally. It's kind of it's not the most convenient, but from just a, biochemistry and physiology perspective, if you do get a bioidentical hormone cream, administering it vaginally seems to be the most protective and safest way to take it. Progesterone, I recommend actually usually in capsule form, because the bioidentical progesterone in capsule form has more of an impact on the brain. It impacts GABA receptors. And GABA is a calming neurotransmitter, a calming brain chemical. So bioidentical progesterone in capsule form taken right before bed can be very helpful for anxiety and for difficulty with sleep.
Interesting. Yeah. Everything is related.
Yeah. It's all connected. Yeah.
So do you have any advice for women who are thinking, okay, maybe I need to look into this, and they're trying to find a doctor and they maybe need to know what kind of testing they should be asking about as well?
I really like A4M, the American Academy of Anti-Aging Medicine. They're wonderful. So they put on a lot of medical conferences for doctors like myself that we go to every year, all the time to just increase our knowledge base. But the doctors that are part of A4M tend to be highly credentialed and highly experienced with using bioidentical hormones. If they say that they specialize in that, the training that kind of comes through A4M is pretty darn amazing and thorough. And they have different tracks that are very specific for BHRT, bioidentical hormone replacement therapy. So I like A4M, and you can search based on where you're located of what doctors are in that area, and make sure you resonate with the doctor. Like don't just like you can interview different doctors, especially when it comes to hormones, women.
Right.
I mean, find a doctor that you really click with and that's going to work for you.
Right.
And it's going to incorporate not just hormones, but lifestyle supplements if it's warranted, etc. And so isn't just interested in writing a script and getting you out the door. You really want to find a partner.
Yes.
And then educate yourself a ton.
That's what we're here for.
You know your body better than anybody ever will. You're living in it. You've been living in it your whole life. So you take the advice of the experts and then get in tune with your own body and make decisions that are specific for you.
Yeah. I'm glad you said that, because everybody has different views about doctors. And I do know some people who kind of just go to the doctor, and they may not even like the doctor, but they're like, the doctor said it, so I guess I'll do it. But it's our body. I agree. Like we know all our quirks. And so, yeah.
And it's our body. It's our life. Like when you take hormones, it's impacting your life. Mm-hmm. So it's your body, it's your life, it's your mind, it's your soul, it's your energy. And so, I wouldn't just, hey, the doctor said do this, so I'm just going to do it. First of all, you really want to make sure you are embracing whatever the treatment plan is, and that you're part of it, and that you want to do it, and it makes sense and it feels good for you.
Yeah, absolutely. Well, there has been a ton of great information in here. So we know what bioidentical hormones are. We know what to look for. We know why they're safe and what the risks were when it was synthetic. We know a bit more about detoxing and what your favorite supplement is for that, as well as some other things we can do. Do you feel like we missed anything?
We missed anything? I mean, there's so many.
I know that's a hard question to ask.
I do encourage people to look into glutathione and what it is. It's the mother of all antioxidants. And I find in my practice, when I'm giving it to my patients, sometimes some women don't want to take hormones, and they can just take, it's called Best Daily Ever. They can just take that, and then they don't have the symptoms of menopause. And then when they stop taking it, it comes back. And that I found out by chance. I wasn't even looking at using it for that purpose. But I put people on like purification programs. And so I have like a 21-day purification program. I always put women on that, whether they're trying to get pregnant or they're going through perimenopause or menopause, any hormone related issue. I always put them on a purification program. But I didn't, and glutathione's part of it, but I never thought of just prescribing Best Daily Ever for a woman who is, going through perimenopause and menopause and doesn't want to take bioidentical hormones. And then I also give it to patients who are on bioidentical hormones to help with the clearance of the hormones.
Right.
And so it's just so powerful. And I've been in the supplement world for 20 plus years. So I've tried all the different supplements. I've formulated supplements for a ton of companies. And so I'm a supplement snob.
Nothing wrong with that. It's hard to know what's good. It really is hard to know. Oh my gosh.
You really have to be discerning and wise when it comes to deciding what supplements to take, for your body. And that's like another conversation.
It is.
Yeah. But anyway, other than that, I can't emphasize enough the importance of taking the time to meditate or whatever, and in whatever form that is for you. Women are under so much stress these days, and stress affects your hormones. Stress makes perimenopause and menopause worse, and so sometimes just dealing with the stress part of it will help you with, a lot of your symptoms. And if you're less stressed, you're going to make better decisions about what to take for your body, And it can be like, everybody has a different way to meditate. I like being out in nature, to be out in nature or get in the bath, journal, whatever works for you. But again, as a busy woman to another busy woman, deciding that you're going to take that time for yourself, whether it's 10 minutes a day, 20 minutes a day, where you just carve that out, and that is your quiet time to get centered with yourself, because, we are our own best inner guides.
Yeah,
That
for
is
sure.
my truth. Yeah.
And you know what? Everything is interconnected. So we need that reminder, because I do think sometimes we want to just take a pill and then keep going the way we're going.
Yes.
So we need that reminder.
Always. I mean, daily, so.
Absolutely. Okay. So how can someone find you, connect with you, find out more about glutathione, any of that? Tell us that.
Yeah. So I formulated Best Daily Ever. It's the glutathione. So if you go to bestdailyever.com, you'll see all the information about me and the product and all of that. And then for my practice, if you just go to drgina.com, so drgina.com, you'll see information about the purification program and hormones and all.
Perfect.
Of that. Yeah.
Excellent. Thank you for that. Okay. So then the final question as we wrap this up is, I always add a song to the nostalgia Spotify playlist for every guest. So tell us a song that has good memories attached to it or makes you feel nostalgic when you hear it.
I'm going to have to say, so I love Enya. It's very calming music, but there's a song called Wild Child, and that was playing while I was giving birth to my daughter. And so every time I hear that song, I cry. My tears get in my eyes because it was such a magical moment. And it really came like it was just such a special moment for me because of what led up to birthing her naturally and all of that. And so that's the song, Wild Child by Enya.
Sounds fantastic. I love Enya as well. So yeah, I will add it for sure. Awesome. Well, Dr. Gina, thank you so much. I know this is going to matter for people who are listening, and listeners, if you have more questions, find her online. I will put those links in the show notes to make sure that you can. And this has been a great chat. I appreciate you being here.
Oh, it's my pleasure. Thank you for doing what you're doing.
I hope you enjoyed today's episode. OMG, did you know that we have mini episodes every Friday as well? Make sure to follow OMG Teach Me in your favorite podcast app so you get all the goodies. And if you're just finding this podcast and you're kind of wondering where to start, I have a curated mini series for you to help you stop self-sabotaging, because we all do it. So head over to www.omgteachme.com and sign up when you get the pop-up box. We may not have learned all these things in school, but they sure are powerful now.